Hi guys, and welcome to this video. I'm going to tell you my story of my C-section. My C-section story that occurred many years ago when I was fixing to have my firstborn in Indianapolis, Indiana. Stay tuned, as this is my story time. Going back to yesteryear, my ex-hubby, my hubby or whatever, was working on the baby room, the nursery, and about 11:30 at night I began having contractions, and we timed it, and it was, I think, the 7 minutes apart type thing. And so anyhow, we lived in Shelbyville, Indiana at the time, and so we had a good little haul to the hospital in Indianapolis, yeah. So it was at least a 40-minute drive. So anyway, I already had my bag packed up and everything, and so we loaded on in and headed to the hospital. And I tell you, I actually thought I was going to have it in the car. So he was like pretty much flooring it because I was having severe pains. So anyhow, we were on our way, full speed ahead to Indianapolis, and I was just in such severe pain and agony or whatever. So anyhow, he pulled right up to the door, and I went in. He helped me in and everything, and got in a wheelchair, and they took me upstairs and began to hook me up with IV and everything, and they checked to see how far apart the contractions were, and they informed me I'd be staying as the contractions were getting even closer. And this and that. So then they eventually put me in a room, and the contractions were beginning to get closer and all that good stuff. So then, of course, you start the pushing process, and well, after hours and hours of that, a good 5 hours, nothing was happening at all. She just wasn't coming or whatever, you know. And they had used all sorts of stuff to attempt to help the delivery along, even where I had to get on the table and attempt a walker thingy to attempt to deliver her. Bottom line is nothing was happening. She just wasn't fetal monitor hooked up and everything. But they discovered that she was having fetal distress, which means not enough oxygen or whatever. And this was after many hours of attempting delivery. So once they discovered that, they let me have one more contraction, and then within lightning speed, they had a bed in there, instantly put me onto the bed and ran me down the hall like something out of ER and into the OR. And the anesthesiologist told me to look up. I looked up. He stuck something in my mouth. That's the last thing I remember. They were trying to wake me up. I remember shaking a lot. My arms were out on the side, and I was shaking a lot. And they were attempting to show me my baby girl, who had tons and tons of black hair, just like her dad, I must say. And I eventually came out of it. They put me in the recovery room, and I was in there for about an hour or two. And then on the way back from the recovery room to the room where they were going to have me at, there was this window in the nursery, and they were holding my beautiful baby girl up. And it was just such a miraculous moment. Lots of hair. And when I say she has lots of hair, her hair was down to her neck. She even had hair on her forehead. Thank God that part fell off though. But anyhow, she had beautiful blue eyes. So bottom line is I had a C-section, and of course C-sections are very, you know, you're a lot of pain with that at times. But let me move the story along a little bit, in that I was in the hospital for, I guess, 2 weeks or whatever. And yeah, I would try to take care of my baby girl. You know, when you have a C-section, you know, it's your stomach and everything's very tender and everything. But I hated to leave her in the nursery, you know, because like She'd be about the only one in there. So I would always have her there by my bed and attempt to do everything I'm supposed to do. And one time she pulled the IV out of my arm. And none of the nurses hardly had done any IVs on the floor. So it's like they must have did about 8 sticks trying to get an IV back in me. And they weren't being able to get it. So they said, well, we actually have one nurse on the floor that's done a stick before, an actual IV. It's funny, if you're not on the maternity ward, very few nurses on the floor had done IVs. So this other nurse came and attempted to give me IV, and it took her a lot of tries too. She just couldn't find a vein or whatever, but she was getting really irritated with me as I was really tightening my arm up and everything, which she claimed made it harder to put the IV in. It took her about 6 tries to get the IV in. So anyhow, bottom line is with that, moving right along, is I kept running a fever with my C-section. They would start you off pretty quick, wanting you to get up and out of bed and walk on the floor with pulling your IV thingy and everything to try to get you mobile and everything and helping the healing process. I was running a temperature with my C-section, and they were very concerned about that. I would just keep wanting to go home. I was in there for 2 weeks, wanting to go home, bawling for no reason at all, wanting to go home. So I guess I had that thing, what do you call it, that you get sometimes when you've had a baby. I don't know, but I would just be crying a lot, and they were, of course, documenting. Bottom line is I got a fever and all this good stuff. So the doctors rather, were very concerned about it. 2 of them came in my room. I wasn't supposed to eat anything. I wasn't supposed to eat anything because I was on a liquid diet, right? And I knew that. Okay, so the food person came in and asked me, was I able to have a sandwich? And I said, well, they told me not to eat anything except for the liquid stuff, right? So she said, well, let me go check. And so I supposedly went and checked, right? And came back, and she came and handed me a sandwich. So I thought that meant, well, I could eat something, right? The doctors came in. They were very upset. You ate a sandwich? Yes. How much did you eat? They were just really getting upset with me. Anyway, they said, bottom line is I was in trouble. And, anyway, I'd eaten something that I wasn't supposed to. Because Lord knows that liquid diet don't do nothing for the hunger. I was running a fever. The doctors came in one morning, were very concerned about the fact that I was running a fever and was keeping running a fever. They had this huge Q-tip, and this was a very torturous procedure. They took a huge Q-tip and wanted to push it into my staples in my stomach to see if pus came out. And needless to say, pus came out. And they knew, obviously, that there was infection in there, and they needed to fix that. So, then, within just minutes after, they said, we're going to cut you back open. Do you want to do it here, or you want to rather go back down to the OR? And I'm thinking, well, you guys are the ones doing this procedure, so whichever place you feel comfortable. But they wanted me to make the call, so I said, well, if you can do it as well here is fine. I was watching, I think, some show back then. It was called War of the Worlds or something. They decided to do this surgery back in just my room. So they went out. They came back in with a surgery tray. My hubby was right there by the side or whatever. And he was making all sorts of faces, needless to say. But anyhow, they gave me these shots, and by the way, I was squealing when they stuck that Q-tip into my incision. I was squealing. That was painful. I don't need to elaborate on that. In my incision to numb, and then they just like that. They tested to see if you were numb. Good. And then just like that, they took a razor blade and just slit my stomach. Then they began the process of cleaning the wound out. They wanted to clean it from the inside out, right? So they took some iodine pads and they just like sandpaper, and they scrubbed it. Of course, I was numb during this procedure. They scrubbed it on out and cleaned it out real good. Instead of sewing me back up, they decided to stuff me like a turkey, you know. They stuffed gauze in there, right? And then they taped over. They want it to heal up from the bottom upward and be cleaned out twice a day. I tell you, once the numbing wears off, this was a very torturous procedure. Nurses would come in my room 2 times a day, morning and evening, and clean my wound out. And I do not need to tell you, especially at the beginning, it was very painful. This is raw skin, and it was pretty deep, of course. And so they untape, take the craft out, scrub with iodine pads that were like sandpaper onto raw skin. And they did that. And even when they told me I was able to go home, it would still have to be done at home 2 times a day, and I wasn't about to do that. I couldn't do it, really. I mean, my stomach just couldn't take it, because it still had a lot of healing to do before the skin was level. Anyhow, my hubby was the one that would do that task. So, yeah, so anyhow, that's my C-section story, and it was a very torturous procedure, and especially once it got infected and everything, and I swore I'd never have another child, but I did. A year after, I had another one, and thank goodness. And they are such a blessing, I must say. And that's my C-section story. So, yeah, so if some of you other guys have stories to do with childbirth or whatever, C-sections, leave in the comments section. Thanks so much for watching. Please subscribe.